After his own COVID-19 diagnosis this week, Governor Greg Abbott says the monoclonal treatment he received will be more available across the state, with more antibody infusion centers opening by next week. So what is it like to get the treatment? Zach Tavatari tells us about one patient's experience.
For Houston psychiatrist Dr. Matthew Brahms, who contracted COVID last December, staying out of the hospital was a priority.
I had a lot of risk factors. I was older, I was overweight, I had diabetes, sleep apnea, maybe mild heart dysfunction. So I didn't want to end up in the ICU.
Days after testing positive, he received monoclonal antibody infusions through Memorial Hermann.
It was painless. There were no side effects, and it may have saved my life, but in the very least, it probably kept me from going into the hospital.
Dozens of providers across Houston have the treatment. Houston Methodist has 800 appointments scheduled this week. The antibodies are generally available for anyone 12 years and older at risk of severe illness. Memorial Hermann has treated hundreds of patients so far.
For the large, majority, patients are not progressing to severe illness and disease. They're staying out of the hospital.
And with hospitals and ICUs at or near capacity, Brahms, who contracted COVID before the vaccine was available, considers himself lucky and says the goal should be protecting people from the virus in the first place.
As a public service, everyone should be vaccinated.
And Memorial Hermann says it has a permanent location for infusions at its urgent care Greater Heights location, but that patients can get the treatment by showing up at emergency departments. Zach Tawatari, KHOU 11 News.
Monoclonal antibodies have been used to prevent hospitalizations after someone tests positive, but now the same medication is being used to keep people from getting sick in the first place. This version is given as a shot instead of an infusion. Houston Methodist started using the therapy this week. It is for high-risk patients 12 years old and up who have had close contact with someone who is infected.
Usually people who are in the same household, for example, and have kind of pretty close contact or work very closely together, been in kind of a small area with relatively poor ventilation.
Clinical trials found the shots are 81% effective in preventing symptoms of COVID-19 after a direct exposure. It can be used whether or not a high-risk patient is vaccinated.